Okay, so just to kind of restart again, we're talking about the deadlift. The last little bit I'm going to talk about with the deadlift is your glutes. So there is kind of common issues that can happen here with the glutes. Things like you'll see somebody deadlifting and they might swing a certain way, so they might turn slightly. This could be due to damaged quad muscle, can be due to tightness in the glutes. But essentially, when we look at people who have lower back pain and maybe have issues around their hips when they are deadlifting, like tightness, pain, it usually comes from the glute minimus. So again, the glutes are put into different sections: glute minimus, glute maximus, and you've got a medialis in there as well. The minimus is the kind of smaller one, and it curves round the kind of top of your hips into the kind of lower back region. It can all sometimes can be a factor in piriformis syndrome as well. So again, we would look at these glute minimus to see, are they functioning properly? Are they overactive? And a good way of seeing this is getting a client to lie face down on the floor and get them to do a glute kickback. So just straight leg, get them to raise the heel off the ground, and you will be able to see most of the time if their glute fires first, if their lower back fires first, or if their hamstring fires first. Now, a normal person, it should be glute, hamstring, lower back. Lower back will be the last thing to fire. And the second thing that will happen, obviously, in that kind of chain is misfiring. And the most common misfiring is going to be lower back first. So if you see the lower back muscle starting to tighten first as they do that that leg kickback, we would try fix that through some form of stretching. There is good P&F stretches you can do to help that kind of thing. And you usually find quite quickly, after giving some attention to the flexibility in that area, that the pains that they did have, they just don't exist anymore. It is wonderful when you look at the body and its mechanics, how just getting some flexibility into a certain area can take away pain. Another thing could be that flexibility in the ankles, as we talked about earlier on. That can cause pain in a deadlift. It's less common because we can change our position, but it is something that can pop up as well. The kind of last exercise of the kind of four kind of major lifts I'm covering just now is the bent over row. And it suffers a lot from the same issues as a deadlift would, except we also now have to be able to hold our core. So what you tend to find is people who aren't good at bracing can sometimes flex their back too much, and this can cause a couple of things to happen. It could be that they aren't in control of the weight, so again, dangerous. We would have to work on that core element and how they brace to be able to get that fixed. But the other thing will be that you will see swing back and forth. So when you're doing a bent over row, the body should be maintaining its line. So personally, I like to do my bent over rows where I'm parallel to the floor. So I don't want my body to move from that parallel line. Some people like to do bent over rows at different angles to hit different muscle groups, and that's perfectly fine. But we shouldn't be swaying back and forth. That's quite dangerous. It can give you lower back issues. It probably shows a lack of strength around that lower back area if they're having to flex a lot, or it could be that they've put too much weight on the actual thing itself. Again, anatomy wise, depending on how they do it, if they go with an overhand grip or an underhand grip, that will cause different things to happen as well. If you go overhand, you're going to be able to Probably change your grip to wider with a heavier weight and still be okay. You can't do that with an underhanded grip. And also the underhanded grip, people who have tight biceps, tight forearms, tight shoulders are going to suffer with that move. So they may want to change back to a overhand and work on the actual issues of opening up their chest, shoulders, biceps, and forearms. So that's things we would look at for common issues with that. And as I said, I was going to throw in the belt at the end as well. So the belt itself is a great tool and one that should be used for people of an adequate level. But what people think the belt is for and what it's actually for are two different things. So a lifting belt is for giving you something to push your diaphragm against to help with stabilization of your core. This should in turn allow for pressure to be built up and for you to move a heavier weight than maybe is naturally can occur. What people commonly use the belt for is because they think it protects the lower back. It doesn't. It's not there to do that. That's not the function of the belt. And when people wear the belt for that function, what they're doing is they're causing instability in their spine. They're causing issues to occur with muscles not actually taking the load properly. And it can actually develop problems for them around about that area. So my advice is to always work with somebody until they can't lift the weight anymore. You know, they find it a struggle because they can't brace anymore. They know what bracing is, and literally they can't cope with the load. It's probably going to be close to the 1 rep max in that case. And in that case, we would probably look at introducing the belt then, not before, and see if it actually has an effect to somebody. Before that, you want the body to really be able to take the load because it just strengthens everything across the rear kinetic chain, the tissues all throughout the entire body, because everything is interconnected at the end of the day. So belts are good, but always try remember to tell your clients what their real use is, because that's where misinformation comes from old school bodybuilders and X, Y, and Z who they've heard through friends and stuff like that. So that's a nice one to end with, because that is something that can commonly cause injuries with clients as well. That's me finished for the evening. So I'll stop the recording now